Hey guys, I feel like it's been a while, just because my last 1 or 2 shifts I didn't vlog because nothing was happening, and I wanted to have the meeting with my managers to discuss like me progressing and stuff, because I felt like I wasn't getting much opportunities on shift. But today's been a bit different. Yeah, so today so far I'm on the birth center still. And I came in and they said that they have ladies for us on delivery suite, which I was happy about, because I was like, oh, are they going to close here again? And then I won't actually get birth center experiences, because that's been happening for my past few shifts. But we went downstairs. We got a handover of one lady who was low risk care. Her only things was she had hypothyroidism. She's 38 plus 5 weeks. And it's going to be her fourth baby. No, her third baby, but she is gravid of 4, so she has been pregnant 4 times. So yes, and that was kind of all with her. She had actually come into A&E for another reason, but in A&E they gave her an examination and they said, oh, she's 3 centimeters and she's in pain. Then they gave her 2 more examinations and they said, oh, she's 5 centimeters with bulging membranes. And then she came over here, she was examined again over here, and then they said that she's 3 centimeters. Then they said that she's 4 centimeters. Yeah, so she's 4 centimeters. No, she's said to be 5 centimeters at 6 a.m. this morning, and contracting a lot and feeling pressure, and just refusing pain relief. So she wanted to have just to use the gas in there. She didn't want epidural or anything. So we're like, okay, then we can take you upstairs, because down here is for people who want the epidural. Like, the room is needed for someone who's requesting epidural, but she didn't want to come upstairs. So it took us a long time, but eventually she decided to come upstairs. And since we've been upstairs, I've just done her obs. Been listening to the fetal heart rate every 15 minutes. We gave her an examination and found that she's actually 4 centimeters. And the midwife was like, I knew she wasn't actually in established labour, and how the cervix is not well applied. It feels quite gritty. It's very posterior. And yeah, it's just not what we thought it was. So we're stepping down labour care, and she's had pethidine. After pethidine, you give the woman an examination. So pethidine is an injection in the leg, and it does make woman and baby sleepy. So she's resting now. Her contractions are very sporadic. Like, sometimes it's like every 5, sometimes it'll be in 5 minutes and it'll be in 2 minutes. Like, it's not established. So yeah, she's actually ended up in hospital before she actually needed to be in. But it's okay, we're going to help her mobilize and help baby descend. So that's the plan for today. Also going to start a fluid balance chart and help her with hydrate, like encourage her to hydrate and everything. But so far so good. I do hope I can get a baby today, hopefully. Yeah, but that has been today. I'll keep you guys updated. Oh my gosh, guys, just had a baby. I don't know how that happened. She was 4 centimeters. Like, it's crazy. I will give you the information in due time, but I think I'm about to have another baby. You know, my goal for this week was literally, oh, just 3 babies would be nice on each of my shifts, because I've got 4 shifts and I've got 1 already. I just pray I get another one. That's amazing. But I'll update you guys soon. Yo, guys. Today's a mad one. It's crazy because the week I had last week, my last 2 shifts just seemed like nothing happening. I'm just doing ops the whole shift, so I wanted to speak with my managers about it. But today, things have changed. But I'll carry on from where I left off. So, yeah, so, by the way, they've just sent me on a tea break. And she asked, oh, do you need a tea break? I said, yes. It is only, almost 1 o'clock. But today's been eventful. So like I said, that lady already had a baby, so she's para. No, she already had 2 babies, right? So she's para 2. Para 2. Gravid of 4, para 2. And yeah, what I was learning from the midwife was that when a lady is actually in established labour, between contractions, you have to observe her and see is she able to talk and hold conversations, are her eyes wide open? And this lady was able to speak with her husband. Her eyes were wide open as well. And she was just very alert and not like gone, because when a woman's in labor, a lot of them don't want to talk. I was a bit like, wow, okay, yeah, this is not actually established labor. So that's what was in her mind. And after she examined, she knew. But okay, so we stepped down labor care, as I said, but then an hour or so later her partner was calling us. So I went to go and see her, and then she was telling me, yeah, there's water. So basically, more fluid was coming, and I was a bit surprised because I thought she already shrommed, but the amount that was there was even going on the floor. I was like, did she shrom? But the midwife was like, maybe it was 4 waters. But I changed her pads and everything, and her gown was wet, so I wanted to get her a new gown. So I went to go inform the midwife. And when I was looking and changing her pads and stuff, I could see that her vulva was opening. So she was having vulva gaping, vulva opening. So I was like, wow, she has really progressed. So from that instance, we stayed with her for the whole time. We asked her if she has indication to push, and she said yes. And yeah, I was listening to the fetal heart rate every 5 minutes. She went on all fours, and in the all fours position, the best way to listen to the fetal heart rate is to listen between the legs. So put your hand, the sonicade, between her legs, and then place the sonicade just at the top of the mons pubis. Yeah, the mons pubis, can't describe it. We'll go over your anatomy if you don't know. Well, yeah, just on top of the mons pubis. And yeah, at the top of the mons pubis, yeah. And then you'll get the heart rate, because I couldn't initially get it. Then the midwife gave me that advice. But yeah, the midwife was so nice. She gave me a pillow for my knees, because I was on my knees listening in. And then I don't think I've delivered a baby on all fours before. So she asked me, I said no. And then she was just like, yeah, so we'll guard the perineum this way. And hold on to baby's head this way, because of the shape of because of the pelvis and everything. We're gonna go bring baby down and then up, because if we just bring baby up straight away, it's like baby's just gonna hit onto the pelvis and the coccyx and the sacrum and everything, so it won't be effective. And basically what we could see on mum's, just coming from the anus up mum's back, was a purple line. This purple line, because remember, we haven't examined this lady, this purple line indicates that a woman is fully, and it can really be seen when a woman is on all fours. That's what she said. I was like, wow, I've heard this before, but I've never actually seen the purple line, but it was very distinct. So she was like, yeah, this is an indication to us that she's fully dilated. So her pushing, she can go for her body. So as she's pushing, as we're listening, I could see like I could just see white. And we figured that it's the water. So she was like, yeah, when mum's pushing, you just move out the way, because you don't want it to go all over your face, because that's happened to me. I was like, rah. So potentially the waters could have like just burst on my face, because baby was literally still in the sack. But yes, long story short, her pushing was amazing. Baby was just there. Baby came out in the sack, like, yeah, and then the head was out, and like you see the baby's hair and the face and stuff, but the sack was just like, you know, like when you fill a bag with water and like the bottom of the bag is sinking down. That's literally how it was. So yeah, I was like, wow. So yeah, baby was born within a few minutes or a few seconds. The body came. And then mum was just a bit so flabbergasted. She didn't want to hold baby, but we wiped baby, stimulated baby. By the way, we were wearing blue gloves, yeah. And it's a thing where I'm always like told, oh, put on sterile gloves, but birth isn't actually sterile. Even like when she was pushing and I was guarding the perineum, she was pooing, so even the poo must have touched my gloves. I went to go change my gloves, but she was like, nah, when you're working with me, there's not really need for sterile gloves, because it's not a sterile thing, as long as your gloves are clean and you're clean and all of that. But yeah, so that happened. I gave mum Syntocinon. The indication for Syntocinon was her BMI, and because she's para 2, and before we knew it, placenta came. Dad didn't want to cut the cord, so I cut and clamped the cord. I clamped the placenta, and the placenta was also just there, so I didn't have any trouble with that. I guarded the uterus and brought the placenta down. Placenta was intact. And then there was another lady going into a room, and she's I looked after her already. I was with her before. She came from the antenatal ward after her waters broke. She was 3 centimeters, but she's also she's a para 1. So we are thinking that she's gonna progress quite fast in it. So yeah, the midwife was like, oh yeah, we went to get the placenta. She's like, yeah, go and look after her now. Hopefully you can get 2 babies. I was like, this is mad. This shift is going way different to how my last week was, and I guess that's part of it. Like, every shift can be different, kind of thing. But I'm really being looked after today. I'm learning loads. I'm being stretched, and hopefully, fingers crossed, I'll be coming to you later telling you that another baby is here. So yeah, guys, I am in shock. I just got another baby. You know what's insane? So I'm looking after this other lady. I don't even know much about her, because when I delivered the baby in placenta of the other lady, they said, okay, I should go and provide labour care to another lady. And it's so like more laid back on birth centre. Like, they look at the whole clinical picture. So how many times she's contracting in 10 and all of that. And she was like contracting 1 to 2. No examination was done. I wasn't listening to the fetal heart rate every 15 minutes because she wasn't in established labour. But I knew she was para 1, so I knew she was going to crack on at some point. But her back was hurting her so much. Her back, and I think she was contracting in her back. So I'm talking to her about changing positions. I even got her up walking, by God's grace, because normally women are like, nah, they're not getting up. But that was the whole clinical picture. Her sounded like she's progressing, but she sounded like that from when she was at 3 centimeters. So I wasn't sure. I came out the room to go and update the midwife, and they were like, yeah, she's probably going to have her baby this afternoon, so I should go on my break. Went on my break 1:30. 2 o'clock, I heard some noise, and I was like, I heard noise at 1:30, and I was with someone in the staff room. They were like, she sounds like she's having a baby. And I was like, yeah, but it's time to go on my break. So at 2 o'clock, I heard the call bell and I heard noise. I was like, nah, let me go back. This woman's in the toilet. So basically she had pethidine as well. So that pethidine really works. Like, pethidine gets a woman in a relaxed state, and then in that relaxed state, baby just tends to descend down. Woman's relaxed, baby descends, and before you know it, especially when they're para 1 or para 2, baby's there. It's crazy. I just can't believe it. I can't believe it. Because people are like, oh, how many babies? People don't do midwifery, but like, oh, how many babies did you help birth today? Or they say deliver today, but obviously I don't use that terminology. How many babies did you help birth today? I'm like, 1 or none. Like, labour's not that fast, it doesn't work like that. But today's ones have been insane. The favour of God. Me and my friend was literally praying about this because my last week wasn't great in it. So I was like, oh, I just want at least 3 babies this week. I've got 4 shifts. 1 shift and I've got 2. This is God, I'm telling you. God's working on my side, and God's working on the side of the women. That woman's perineum was intact. Oh, I'm not even there yet. Okay, so yeah, so then I came in the room. She was in the toilet, and there was 3 midwives there. And then I think baby was coming out. So one of them was holding onto the baby's head and was saying, okay, let's just get you to the bed. The other one told me to put on gloves. They're like, okay, let's just get you to the bed. We'll get you to the bed, and then we'll keep going, kind of thing. She's like, I don't think I can make it. I can't walk. And they're like, no, we'll help you. We'll help you. Got her on the bed, got her onto the all fours position. Baby's head was out. I was going to feel for the cord, but I guess on labour ward they do things differently, because the midwife was like, nah, there's no need for that, because baby's chin is out, so there's no need for it. So I was like, cool. She's like, again, as we did before, bring baby down, then up, which is called downward traction, in it. And she's like, yeah, if she's pushing and baby isn't coming, then do that. I was waiting for her to push, but the midwife like stepped in and helped me kind of bring baby down, because I was waiting for the pushes, but I think maybe because of the time, she was like, okay, let's just kind of get baby out. But yeah, it was crazy. And then delivered the placenta. I didn't get to assess the perineum just because Dad didn't want to actually hold baby yet, so I had to hold baby while the midwife assessed the perineum. But the midwife said she's intact, not even barely a graze. I said, oh, this is like one of the best shifts ever, because that one was quite fast. So not that I didn't learn anything, but it was just very fast. The first one before, I learned so much working with the midwife I was working with, but this has just been amazing. Yeah, like 2 beautiful babies are born. She's got a beautiful name. Yeah, I'm gassed, and now I'm on 19. Within one day I've gone from 17 to 19. Listen, like, God can do anything. So one student just told me, make sure you pray before your shifts, pray about who you're going to be working with, pray about what's going to happen in the day. And things don't always go to plan, but I'm really seeing God's grace in this, and it's helped me to know that on the days that things aren't going to plan, anything can happen the next week, the day after, and that, yeah, I'm in this for a reason. I'm loving what I'm doing, I'm enjoying what I'm doing. And yeah, the progress in third year is just going up, so we thank God. Like, labour ward has probably been my least favourite all the time, but when I'm there more and I become more competent, I actually love it. Yeah. But yeah, man, I'm just so happy. Thank God, thank God, thank God, thank God. Guys, today has just been mad, and tired is honestly an understatement. Nah, this is crazy. Guys, I got another birth. So I'm so tired that I'm just gone. But I came to the library because I want to at least do an hour of work for my dissertation, because my friends advised me to at least do a little bit every day. Can't stay for too long because I'm working tomorrow, but I got 3 in one day. What? Me and my friend prayed yesterday for 3 in a week. God gave me 3 in one day. I'm so blessed, and I'm so happy for the woman. So what happened was, basically, a woman called up, and the midwife was like, how she's actually 1 in contracting 1 to 2 in 10, but she wants to come in and she's a primate. So sometimes when the woman's a primate, everyone's like, oh yeah, like it's gonna take longer, or she hasn't done it before, so she doesn't really know, sort of thing. But this woman came in, I'd done her obs, her urinalysis, checked her urine and everything, and then I was with another midwife, and she checked how dilated she was, and she was taking so long to do it, and she was like, oh, so when did you start contracting? So you've been like this since this time. And she was acting like, say, the os probably wasn't open, so I thought she's coming to say 1 centimeter, or that the os isn't open. And then she was like, yeah, wow, okay, you've come really far along. And the woman's like, are you trying to tell me, like, you're going to send me home, like there's no progress, like there's nothing? And she was like, no, like I can almost feel like no cervix, I can literally only feel a tiny bit of cervix. And everyone was like relieved, and I was like, oh my days, what are you telling me, what are you saying? But this one didn't really communicate with me much the whole shift, to be honest, so I didn't exactly know completely what was going on when she was doing her examinations and stuff, but I was listening now. But she was like, I found out later that the woman was 8 centimeters, but in the moment I just thought, oh, so she's almost fully. So the duration of time with her, I was just listening into the fetal heart rate every 15 minutes. I did feel like I'm not doing as much, but it was a whole teamwork thing, because at some point, literally all the midwives on the birth center came in to the room, and we was helping mum, because she had been pushing for almost an hour. It was listening to the fetal heart rate, changing position, so on all fours, standing up, laying on her side. She didn't want to be in her back, but when she was on her back, the midwife was doing directed pushing with her, which was quite effective. So then she went back on her back. But then when all the midwives came in, they showed her a whole nother position, which is basically, I can't demonstrate it now, but I'll try my best to explain it. Basically, where her and the midwife hold hands, and there's another midwife behind her, and she has to lean back to the other midwife behind her, while the other one is kind of like creating tension, so she has to resist the other one and lean back, and at the same time squat. It's like doing a squat, leaning back kind of thing, with tension in front of you, if that makes sense. Or some people might know it as the tug-of-war method, where you use, I think it's very similar to the tug-of-war method, because you're pulling back and there's resistance in front of you. But she wasn't laying down, so it wasn't tug-of-war, it was her holding onto the midwife's hand. And so many times she said she can't do this, she can't do this, and was getting up to almost an hour and a half. They were saying that, yeah, we'll give it a few more times and we'll probably have to go to delivery suite. But yeah, so I was using the mirror, using a lamp. I couldn't see much because there were so many people in the room, so I didn't know what was happening. But initially I had seen the vulva open. So the vulva was opening, the labia, so the labia majora was open, the labia minora was closed. But then I started to see gaping in the labia minora, and that is like the inner vulva, if that makes sense. Anatomy, man, anatomy. Yeah. So the midwife who was so one midwife was on documentation, the other one was behind the woman, one was in front, and I was doing auscultation, and the other one was had the mirror and the light. So the midwife with the mirror and the light was saying that vertex is visible and stuff. We got her onto leaning back onto like a bean bag. So she was on a mat on the floor, leaning back onto like a bean bag with one leg kind of, so not really on her side, kind of on her side, but not on her back, leaning back. And then one leg up. And then, yeah, that position helped. And baby came and the midwife was making sure there's enough room for baby. And I actually wasn't holding baby's head and she wanted to get a swab. So then I guarded the perineum with the swab. And then after that, she just let go and she was like, she's all yours, Trisha. And yeah, I helped her to birth her baby boy. She didn't know what she was having in it, and she was the first to see what it was. So I did axial traction, downward traction, and I thank God for the midwife I worked with before, because she helped me. The one from the morning, she helped me on both the previous births and like really showed me how to do everything properly. So it was fine. I did everything on my own. And yeah, guarded, done axial or downward traction, so move baby down and then up, and then got the towel and wipes baby a little bit to stimulate the cry, got baby on mum skin to skin, and then someone else administered syntocin on, actually, not me, but I guess I can't do everything, so yeah. And then I kept feeling the cord to see if the cord was pulsating, and it was. So we left a few minutes for optimal cord clamping, and then she was like, oh yeah, she really wants her partner to do it. And I was like, of course. I think when I was feeling onto the cord, she thought maybe I'm doing it. I was like, nah man, of course. So I clamped the cord, and then her partner cut it. And then I could see that the placenta was just there. So I just guarded the uterus, and placenta came right out, literally. Went to check the placenta, checked that they were okay, and it was literally the end of the shift. Yeah. I'm just in awe of God, because I know God did this, but I'm grateful. It was amazing. Yeah, I'm going to do my work, head home, and hopefully get a good amount of sleep before tomorrow. Even if I don't, I'm still buzzing. So yeah, let me leave this here.